Hi, this is Amy from Good Food Unearthed, and my guest today is Leah Wilson from Stand for Health Freedom in the United States. And today we're going to talk about informed consent and the importance of health freedom and what is entailed in all of that. So first, I'd like to ask Leah if she could introduce herself and give a bit of a background and the mission for Stand for Health Freedom.
Yes, of course. Thank you so much, Amy, for having me today. It's fun to be with you and talk about great topics. Um, my background is in complex litigation. So by training, I'm an attorney, and I practiced construction law for a while and absolutely loved that. Never thought I would leave. However, left to devote myself to our natural health clinic, and then quickly became aware that, the most important issue facing America today, and now 2020 has shown how widespread that is the ability to choose how we care for our bodies and how we raise our children. And so through a personal story, my husband and I were foster parents. My passion had been in foster care for over a decade. It was what inspired all of my legal work in the beginning. And we continue to be engaged in the foster care system and advocacy capacities and as a family. And our license was taken away because we don't fully vaccinate our biological children. And that decision didn't make sense. I knew it didn't make sense, but I gave them a chance, the state here, the chance to defend the decision, and they could not give any proof that my children were a threat to the foster children. And no new law had been passed. No new rule had been written. It was simply that a bureaucrat had decided to interpret an existing rule differently. Mm-hmm. So I knew at that point that there was something bigger at stake than my ability to give a bed and a home to children in need, that, the welfare of our family unit and of our future generations was being threatened because the amount of coercion to opt in to whatever medical intervention the state recommends has only been increasing. So it's important that people understand what their rights are and how to talk about those rights so that it can be normalized that people care to take control of their own health and exercise their individual rights and their parental rights.
So Stand for Health Freedom, when did that start exactly?
About 2 years ago, the idea was birthed through covering the measles outbreaks and the congressional hearings. Through Green Med Info, I was helping cover those congressional hearings in the US, talking about what the parents' choices may or may not be to contain the measles outbreaks. And we were at a point where we could send out a report and get 10,000 shares on Facebook. But how did we convert that into true activism to hope for those individuals having a voice in the matter? I mean, you talk to anyone who is eager to see change in a law or an issue in their community, and they're asking, what can I do? What can I do? And the response is often, write a letter. Mm-hmm. And many people, I would say the vast majority of people, either don't have the bandwidth to write their own letter, or they don't feel equipped to communicate the message effectively, or they don't know who to reach out to. And our heart and desire was to remove those barriers, because the voice exists. The people that care are there. They're already there, and they're ready to take a stand. And if we can remove the barriers of who do I contact, what do I say, how do I draft this message, then you can give them that tool to be effective in showing the public opposition to government overreach.
And a lot of people feel at this point that, writing letters and that their voices aren't really worth that much. And what would you say to them about that?
Yes, it's understandable. And there's never a guarantee of victory, right? But there is something about remaining faithful and stepping forward and using your voice while you have it. The other concept that's been really resonant with me lately is we are legion. And what that means is a person can be dismissed, no matter how established or reputable or how much of an expert the person is, that person can be dismissed. However, if you have a heck of a lot of people behind an idea, then that cannot be nearly as easily, or if even dismissed. There has to be a recognition of the existence of that position. And that's why the digital campaigns are so effective, because when you get thousands, tens of thousands, hundreds of thousands of people acting on a specific message and using that message, then it creates effective public pressure. Mm-hmm. And you see public pressure be effective in a myriad of situations. Here in the US, we saw Big Ten football come back because people stood up and said, no, we want the football to continue on. Mm-hmm. And because the public's voice was used and heard, then it was changed. Ticketmaster came out and said that they weren't going to allow people into their events. And there was a pretty immediate uprising, saying on their social media, writing letters, saying, we don't like what we're seeing, and this is why. And because there was public pressure, they, like a couple weeks later, they came out and said, well, that's not exactly what we meant. You know, they had a press release on that. So although we're never guaranteed to win, the agenda of special interest groups cannot go unopposed. Mm-hmm. And this is a way to oppose special interest. One thing that's important to remember, I think a lot of times people want to resort to lawsuits, mm-hmm. but we have to understand that the people's war strategy, the people's voice being heard, has to include the people and public pressure, because the laws and the upholding of those laws in courts follow public opinion. Mm-hmm. The way that the judges understand the law follows public opinion. You know, there is a man or a woman behind that desk interpreting the law through the lens of public opinion. So that's why the voice of the people is paramount in the people's battle. We know that the industry's voices are being heard. We know the billionaires' voices are being heard. And the question becomes, what are you doing to be heard? Because no one is going to do this for us. Mm-hmm. We just simply don't have the tools and resources that the industries have. The industries that have products that bring in billions of dollars annually, the people don't have that on our side. And so it's each of our jobs to take a stand with the tools that we have and show that there's another way to look at things.
And I think what's interesting about that is, even though there's the industry and the people behind it who make up a small percentage of our society altogether, the things that they push forward could never happen without our consent, whether it's, you know, unwittingly given or sort of implied. It's sort of like the Ticketmaster where they test the water, and if there's no big pushback, then they'll just go ahead and do it. And I think you were mentioning earlier about how you discovered that it's sort of a creeping medical tyranny in a way. And I was looking at a constitutional lawyer's website recently about overcriminalization. And there seems to have been like some things that have been enacted or allowed to push through because most people aren't paying attention, and we just accept it and go along with it. And so that brings me to informed consent. And I wonder if you could tell us, what exactly is informed consent and why does that matter?
It's a good question. Informed consent is simple in the terms that you get to be the one to say the direction you take with your health and with any potential medical intervention. There's 3 things that are involved in informed consent, and that is knowing your options, what are the alternatives, knowing the risks and knowing the benefits. And oftentimes, especially when things are not challenged, the only story being told is the benefit, because we already have this common understanding of the fear of a specific infectious disease or the fear of doing nothing. And so if someone is going to give consent, first of all, it means it's not mandatory and it's not being required by an employer, which Canada still has their rights intact. Vaccines are not mandatory there. But in the US, childhood vaccines and in some industries are mandatory, which means you have to opt out. Informed consent is already infringed upon because it's an opt-out system. In true informed consent, you start at a level playing field. You understand what happens if you do nothing, what your options are, what the benefit of the medical intervention is, and then what the risks are. So if a person understands those three things and they're not being told that they have to give a valid reason not to participate, then we have informed consent. And often people don't like to recognize that this whole concept was birthed out of a really ugly, dark time in history, in the Nuremberg trials that followed World War II, and the recognition of the atrocity of how humans had been treated in medical experimentation. So we are living in a very similar time, and it's hard for people to confront. But if you look at what's playing out on the world stage, it is medical experimentation. And it's the belief that there's only one route, there's only one acceptable route to handle it.
Right. And that is actually brings me on to my next question about historically what has happened in medicine that requires oversight and skepticism from people versus blind faith. And anybody who says, you know, well, I'm a doctor, I'm a nurse, I've got a PhD, I'm a scientist, I'm an expert. So I know you mentioned, I think you're referring to what happened in Nazi Germany with the Nuremberg trials, but there's so much more to that, because a lot of people think that that was kind of a one-off, and that stuff doesn't exist anymore, or it wasn't that widespread before.
And I've interviewed two people recently who have given their life's work to bioethics and protecting human research subjects. And you're like, well, you would know if you're a human research subject, right? But are you told that you're a human research subject, I think is the first question. And Vera Sharav is one of them. AHRP.org is her website, and she protects people who are unknowingly participating in human research and those who are knowingly participating. And then Dr. Peter Breggin is another human rights champion in that field. And it's not just Nuremberg, the Nuremberg trials and what happened in the Holocaust. It's also things that have happened as recently as the 90s and early 2000s here in the United States and in surrounding areas. For example, forced sterilizations, where people who were deemed unfit to reproduce would be given a forced hysterectomy without their consent. And that was tolerated for a long time, way too long in the 21st century. And then you also have forced lobotomy to alter someone's brain because of a psychiatric need. And they are deemed unfit to make that decision for themselves. And so therefore it would happen. There have been experiments on Black children in foster care in New York City in the 90s. I mean, we can go on and on. If you look through medical research and things that have happened in the foster system and in HIV research, it's staggering what people are not told about what they're participating in, or what family members are not told about what their elderly loved ones or their disabled children are being subject to. So we have to be aware that there is a for-profit industry that views life through their own lens. And we might not all share that lens, you know, the greater good, the lens of sacrificing the sanctity of life for the whole. And you have to ask yourself, do I share that belief system that we can harm an individual and the whole will end up better off because of it?
Mm-hmm.
How does that add up? And it's just something that we have to wrestle with in and of ourselves. I think a lot of us in our everyday life are waking up a lot of mornings thinking, how did we get here? How did my governor get so much power? How did my mayor get so much power? And it's exactly what you said. We weren't watching. You know, a lot of people have disengaged from politics because they're disgusted by it, just like people leaving the church and turning their back on religion because they're disgusted by religion. And it's not about politics. It's about civic engagement. It's about knowing what's going on so that you have a full understanding of how your family can function and operate within society.
Mm-hmm. Yeah. I think it's interesting talking about, risking the life of one person or sacrificing an individual for the benefit of the whole. And that really comes down to one person's idea of what is going to benefit the whole. And I just want to share here, there was a book written by Richard Feynman. It was a physicist, and he talks about the universal responsibility of scientists. And I just want to insert this here because most people are saying, well, listen to the experts and trust the science, even though we're not really looking at that. But in reality, there's a lot of uncertainty in science, which is why you don't really base your laws on them. And he states that the scientist has a lot of experience with ignorance and doubt and uncertainty. And this experience is of very great importance, I think. When a scientist doesn't know the answer to a problem, he is ignorant. When he has a hunch as to what the result is, he is uncertain. And when he is pretty darn sure of what the result is going to be, he is in some doubt. Scientific knowledge is a body of statements of varying degrees of certainty, some most unsure, some nearly sure, none absolutely certain. And he talks about the freedom of doubt, how it should be welcomed and discussed, and they should demand this freedom for all coming generations. Now, if there's so much uncertainty in there, I wonder how it could be that there could be medical mandates for people, and this, what we're seeing now with this sort of medical martial law and making people acquiesce to medical experiments, and with basically out of coercion and not really informed consent.
And bringing that down to even what our lives look like today. So there's so much philosophy in that. And I love it. I was scribbling down some notes from the quote because it's so good. I mean, it's so basic that science, by its pure definition, includes uncertainty.
Mm-hmm.
And we're saying, okay, but you can break constitutional law if it's certainly safe and effective, if there's no other solution, if you know what I mean. And so it requires all of this certainty in order to have an emergency exception to the laws, which that's a whole nother conversation in and of itself. However, sorry, I lost my train of thought for a second, but the uncertainty in science that is brought up is evident in our own lives, because just look at the staggering health statistics.
Mm-hmm.
So we're being told by our health officials that here's a set of guidelines you can use for the pediatric population, that they should get this many vaccines at this age, that they should get this assessment at this age, that, so you go through and there's 90 to 95 and most times even higher compliance with that system, right? Not very many people are opting out. Some are, more and more asking questions, but if we have a super high compliance rate, but yet they're overseeing the greatest decline in human health in history. So we have children in the US, 20% obese, 20% with an emotional or behavioral or mental health disorder, 1 in 13 with asthma or chronic respiratory issues. And so there's all of this chronic suffering that has become normal under the guidance of these health authorities. So if chronic suffering is normal, how certain are we that the direction we're going is the right one, is the only one, according to the media and the government industry holding hands right now. And if something is not allowed to be questioned, then that is where the power is held, right? So if this path is not questionable, then that's what should perk up our ears and say, wait a minute. If this can't be questioned, then we need to look deeper. We need to make sure that we are crossing our T's and dotting our I's as it relates to the direction we're willing for society to go.
And with informed consent, I wonder if you could share some maybe important international and national laws or statements or cases on consent, and how that's, I mean, what is there outlined for us and what has changed over time?
I think one of the biggest issues facing people right now is the ability to say how you raise your children. And there's century old, case law that says that the parent is the one that is best suited to direct the upbringing of their children. And when you look at, okay, so when does the state know better than the parent? No one can show you that. No one can prove to you that the state knows better than the parent. And then you look at discrimination laws and constitutional laws that exist that protect people's freedom of religion. Well, freedom of religion speaks directly to freedom of conscience. For us to operate according to the dictates of our own conscience, for us to be able to pursue happiness and pursue life in a way that jives with our inner essence, that jives with how we understand our relationship with the divine and with nature and with each other. And those things can't be described in a textbook. And so we can, when we feel morally or ethically checked about a decision, and our conscience comes into play and our moral compass comes into play, then it's a dangerous place to be in to instead look to a scientist or someone in a white coat. Because like you said, our laws were not written through the lens of the medical industry having the final say, or through the lens of medicine trumping our rights. And so it's so important to be resolute and to stand in what's ours and to not just turn the other cheek or turn the other way when you feel that something is wrong, because 2020 has highlighted that we truly are at a crossroads, in the sense that we either stand up and say no and use our voices, even if it's not popular, or we sit down.
Yeah, and you mentioned earlier that what we're going through basically is a medical experiment on different levels. So what's interesting about that is, like with Vera Sharav and the Alliance for Human Research Participants Protection, we're looking at mask mandates and social distancing and lockdowns, which are all basically experiments, because they haven't been done on a vast population like they are. But nobody's been given information to give informed consent, which I think would invalidate them, because they're then a violation of our human rights. I mean, there's one of the best things I found in my research was Article 6 of the UN Declaration on Bioethics and Human Rights, that states that, any preventive, diagnostic, and therapeutic medical intervention is only to be carried out with the prior free and informed consent of the person concerned, based on adequate information. So that means even testing. I mean, it's preventive, diagnostic, therapeutic, all that stuff in there. But I don't think most people are really aware of these rights that they have. So I wonder if we could talk about, what can people do now to stand up for health freedom? And maybe you could talk about the Canadian campaign that you'll be starting.
Yes.
Yeah.
And that is what you're talking about. This is what population-based medicine looks like. So when all of medicine becomes public health and all of public health becomes the practice of medicine, then the constituency or body of people under that governing body are their patients. and how there's no doctor-patient relationship, there's no consent. And it's important to realize that even though there's a single story being brought forward right now, that there is not a unanimous, there's not a consensus on what measures are or are not effective. There's dissenting opinion in a big way that still exists on whether social distancing can be effective, on whether masking can be effective, on whether keeping our children out of school can be effective, and clearly which has more harm or not, given a 99.7% on average survival rate of the virus. So in terms of what people can do, there's a activism slogan that says you need to think globally but act locally.
Mhm.
I think people get crippled by the magnitude of the issues because we're seeing them on a global scale, right? So you're thinking, how can I push back on a global tide? And the reality is that if we are silent and things go unopposed, then we're definitely, the tide is coming in and it's going to sweep over us. However, if we do use our voices to give people permission to ask questions,
Mhm.
if we ask questions in a way that inspires them to think about things, then we have a conversation going that says, you know what, the topic of vaccination and the topic of masking, these are not taboo things.
Mhm.
They're things that affect me and you. You and I have the decision to or not to do these things daily. And so it shouldn't be taboo to discuss it. And it's one of the most compassionate things we can do right now is to even discuss what decision that we're going to make, that we are going to make as it relates to the COVID-19 vaccine.
Mhm.
If
Yeah.
you can tell people why or why not, you're going to do that. And it inspires them to think that there is a decision to be made. And not only talking to those locally in your community, but also to your local lawmakers and telling them what your concerns are. Even if you feel that your concerns are unpopular, they have to know the people's voice in order to ever bring our interests forward. And they have to have the proper air cover to get behind those positions. So if we have data and if we have the law and the people behind us and behind these messages, it becomes really powerful. And that's why we host these digital campaigns, is so that people can use the vetted data and law and statistics to have an effective and powerful message going to the right person at the right time.
Mhm.
And we have, I don't know the number of campaigns now, somewhere around 40 campaigns that we've hosted over the last year in the US. And we've heard from so many Canadians and Europeans and people from Australia saying, how can we do this in our own country? And we've heard from an overwhelming amount of Canadians, I think, being neighbors and having similar things facing us. And so we have decided to launch our first Canadian digital advocacy campaign through Stand for Health Freedom Canada. And that should be out within the next week or so, I am hoping. So when you're listening to this, I don't know when that date will potentially be, but what you can do right now is go to standforhealthfreedom.com
Mhm.
and join so that you get that alert. And when you put your address in, then we make sure to send you things that are relevant in your area. And I know that the Canadian advocates have been getting some of the US campaigns, but now that we'll be able to segregate those and have ones where you can click and have a button to share with your friends and act, that will be a great resource and tool to share with you all.
Yeah, and one of your recent petitions that came out, which I think is really important, is the one with for anybody 50 and over who has decided that even though the statistics from the CDC show that, even though it's a marginal, like a very, very tiny risk of dying from exposure, it's still higher than the other age groups, but they decided that in the petition, in that declaration, that they don't want everybody else's rights and freedoms taken away for their protection. And I wonder if you could tell us a bit about that, because we're told that it's to protect the most vulnerable, what we're doing, but we don't really get to hear from the most vulnerable and what they want to do.
And that's a really good point, because this is all being done under the guise of we are in this together.
Mm-hmm.
But if we sit back and think about it, are we really in this together when there are people who rely on others for their existence? For example, our elderly, and being able to have close contact and communication with others in order to do things like get their groceries, maybe, or to just even have a semblance of sanity and mental health, of feeling seen in this world, is a huge part of it that we're neglecting. And then the other side of that is the vulnerable being the ones who rely on an hourly paycheck. And they get that paycheck by showing up in a physical place and by adding value to that business. And in return, they get to feed their family. And that's who the most vulnerable are. And are we really in it all together if we're sending people home without the ability to feed their family? And what stress does that cause on the home, on the marriage, on the children, on the educational environment, on and on? So Dr. Peter Bregan inspired this campaign because he was saying, this is being done on the older people's behalf, but we see the issue so clearly that we don't want what we've worked so hard to move forward completely decimated for the future generations. So it was exciting to come alongside him and hear his voice on that and be able to give people the opportunity to say, this is not on our behalf. Mm-hmm. And I think in a sense, it's calling their bluff to say, wait, like, we see what you're doing, and this cannot be put on us because we're not asking for it. And I think you realize as your own family members age that the elderly want really nothing more than their autonomy. So if we want to provide them with resources and we want to make sure that we are propping them up to be able to protect themselves, that's one thing. But we're disenfranchising them by telling them that they're too high risk to participate in society and that we're going to shut down things on their behalf. That's so demoralizing to them. And it's not what many of them are asking for.
Yeah, and what's interesting about that, and like there's say it is a small minority of people who don't want to get the vaccine, or they don't want to wear the mask, but I thought it was a key tenet of a free society that even your minorities are protected and respected. And I wonder if you could talk about this respect of personal choice and that individual sovereignty, because we're getting the narrative that, like, yes, we're all in this together and it's for the betterment of everyone, but we forget that everyone is a compilation of a bunch of individuals. And what we're doing is by saying, well, no, what you want doesn't matter, then for a section of individuals, we're saying your rights don't count in this society. I mean,
yes, and Stand for Health Freedom is premised on something pretty simple, and that is choice. That we are all given the opportunity to take personal responsibility of our own health, because it's a false presentation. It's fraudulent to say that I can do health for you or that you can do health for me. And so to force us to participate in something that promises that to another person is bothering to a lot of people's moral compass. I mean, there's so many reasons why people may or may not choose to participate in masking or in vaccination. And we're seeing more of those reasons come to light. So what does it look like for us to take a step backward in civil rights? A lot of people are pointing to century-old law to say that we can force people to vaccinate or force people to participate. And that was pre-civil rights era. There's been a lot that's happened since then. Women got the right to vote in the US, Rosa Parks, the sit-ins, the Montgomery bus rides, all of those things happened after this Jacobson lawsuit that people like to point to that gives states power to issue medical mandates. What's happened since then also is forced sterilizations have come and gone. The forced lobotomies have come and gone. Korematsu, the mistreatment of the Japanese in the US, that's come and gone. And now we've spent the last decade doing what? Trying to prevent bullying in schools. Mm-hmm. And now we're saying, wait, but you can shame your classmate if they're not wearing their mask properly, or if they choose not to wear a mask, then you can shame your classmate or make them feel that they're doing the wrong thing. And it's time for us to include how we care for our bodies in the civil rights, and to push back on mandatory participation in any medical intervention, whether it be, like you said, a test or a therapeutic or a vaccine. Because there's always a choice to be made. There are many ways to look at the body, to care for your body. And I would argue that if you look at the people who are intentional about choosing how they care for their body, there's something to learn from that. And there's a recent study that just came out by Dr. Paul Thomas that compares vaccination, the continuum of vaccination and office visits for chronic issues. And it's a very clear picture. You should look it up. Look up Dr. Paul Thomas and see his recently published research.
Yeah. And I want to touch on that for a minute, because there's a lot of the vaccine story that most people have never heard, because, you know, I grew up in the States and I went to public school and we just got our vaccines. We were told we had to do it. And my parents, you know, just trusted the doctors. My grandmother was a nurse, so she thought that doctors, you know, knew what was best. But there's a lot to that story. And one of the interesting things with the study that you just mentioned is that there's never really been a study between vaccinated and unvaccinated children. And there's also been issues with these studies, well, many issues, but one of them being that there has never really been a saline placebo to use as a control. And I wonder if you could go into some of that information, to just provide some education for people who may not be familiar with it.
So a lot of it is couched in terms, people have been asking for the research behind vaccinated and unvaccinated, comparing those two populations. And it's always responded to with the ethical dilemma of researching something that is readily available and looked at as necessary.
Mm-hmm.
We're seeing it right now with the review of the Pfizer and the Moderna vaccines for COVID-19, that they're unblinding the participants. Moderna is going to unblind the participants, I heard today, as soon as they have their authorization to distribute. Pfizer was going to wait to unblind their participants till 6 months. And there's such a huge focus on the ethics of that. And it's under the assumption that the people want the intervention and that they should get the intervention. That's all, these ethics are based on that assumption. They're ethical standards. However, what people, the government industry, fail to mention is that there are a whole lot of people who don't want to participate, and there's value in observational studies. So if we can't do a randomized controlled study, then what about an observational study, which is similar to what Dr. Paul has done in looking at the two populations and their health outcomes. Mm-hmm. And it's important to know that none of our vaccines have gone under long-term research. So comparing morbidity, mortality. So what that means is death, length of life, and disease. Mm-hmm. So how many other diseases does this person get, and how long do these people live? Do we have a better outcome with or without the vaccines? That hasn't been studied. There has not been long-term research, nor has there been research on the schedule, on getting all the vaccines together and in the sequence that they're recommended. So there's huge gaps in the research. And one of the biggest ones, and one of the most startling that parents don't understand, and therefore we could argue that there's no informed consent, is that the vaccine package inserts, all the ones on the childhood schedule, section 13.1 says they have not been studied for cancer-causing effects, for fertility, effects on fertility, or for the changes in the DNA, mutagenicity. And if those studies haven't been done, yet we're seeing insane rises in pediatric cancer, there are questions to be answered. And the questions are being asked, will we get the answers? Will we get answers that satisfy us? That's where, the crux of it really is, and where we have to feel confident saying, I might have a really good reason not to participate here, and I'm going to do what it takes to stand up. I'm going to leave my job if that's what it requires. I'm
Mhm.
going to pull my kids out of their current educational environment if that's what it requires. And people are asking, what can I do? The biggest thing you can do is stay true to what you see as right now, because we're being pressed in new ways that are making us, funneling us into a single narrative, a single way of caring for ourselves, whether that be threatening our ability to travel, threatening our ability to work, saying that stimulus checks will be connected to the participation, or government benefits connected participation in certain
Yeah.
medical interventions, especially this COVID-19 vaccine. So getting creative and believing in your ability to problem solve and get creative when you feel like you're not supposed to participate in something is huge.
Mhm. Yeah, and what's I wonder if you could talk a little bit more, because what we're seeing is, what I found really interesting is that we're focusing on what we're calling the most vulnerable, and they're usually people as well who don't have much of a voice, like children or the elderly, some who have cognitive disabilities, um, people who are in care homes, so maybe they're also disabled in some way, or they're on welfare. And it seems like they're also the ones who are being first targeted for the vaccines. But I don't know about you, but when I did research into every type of medicine, the side effects for them, including the vaccines, are said, they clearly state that they're actually worse in those most vulnerable um, sections as well, which is interesting. But I wonder, because you talked about foster care, and I wonder if you could tell us a little bit about what you learned, what happens to children in foster care, what kind of medications they're put on, and what we're not aware of, that could actually end up being the case for all of us if we give up our health freedom.
There's one of the issues that really drove me to be active in the foster care system was the over medication of our children. And there's a huge acceptance of medicating children to manage their behavior. And if we fail to acknowledge the cause of the behavior, for example, in the US, there's 240,000 approximately children ages 2 and under on psychotropic drugs. A disproportionate amount of those are in foster care. What are 2-year-olds in foster care experiencing that might lead to a psychotropic drug prescription? You know what that often is that's not feeling safe enough to sleep at night.
Mm.
And are we covering up that true need with a mind altering medication that undoubtedly has risks and benefits? So are we ignoring that there are risks to a 2-year-old, to altering a 2-year-old's mind and covering up their true needs? Going back to basic psychology and looking at, Maslow's hierarchy of needs. How do children or people in society establish a sense of belonging, establish a sense of safety? And if those things are denied, then we don't ever climb that pyramid to realize success, to realize belonging, to realize self-sufficiency. And it's a real issue, to think that we can cover up true needs with medications, especially when these children don't have their biggest advocate, and that's their parents.
Mm.
For whatever reason, their parents needed help for a season or maybe for even longer, but those parents needing that help does not negate the value of that child and how that child should be ardently advocated for. And that it's so important that their experience outside of their parents' care isn't taken lightly. And so for sure, an over medication of our youth, and screening is often used, in the public school systems, to funnel into doctor's visits that end up in prescription medications. And so we have to also be aware of those things that our children are participating in, and what is our ability to opt out of screenings that really are being used as funnels for doctor's visits that end in prescription medications.
Mhm. Yeah. And with the elderly, I don't know if you know Dr. Peter Gertza, who started the Cochrane collaboration,
Mm,
but he wrote a book called Deadly Medicines and Organized Crime, and he exposed how big pharma, they meet the criteria in the US for organized crime, and they have been charged and convicted. Um, but most people aren't aware of that. And he mentions in an interview that with the elderly, he would start to take them off of much of their medications. And what was surprising was that they started to become alive again. But it's this huge section. Like I know, especially once they're in care homes, and if they're already, for having the effects of all the drugs that they're taking, not really able to focus, or they're under the care of a family member who's following the doctor's orders. Um, they don't have a voice, and they're also just as vulnerable and really treated the same way as we treat a child,
mhm.
without respect for individual sovereignty and choice, and without trying to reach them, communicate with them respectfully on their level, kind of thing. um, what can you tell me about what you know of long-term care nursing home effects and people who are in the welfare system?
They definitely fit into the category of the most vulnerable among us, who it's the greatest injustice when people are denied a voice and disenfranchised because of their vulnerable position. And our medical system has been caught acting in predatory ways in numerous capacities over the last few decades, especially. And when you look at what happens in our long-term care facilities and the over drugging of our family members, it's staggering how many times family members go in and say, whoa, when were these medications added to the list? And oh, there's a drug interaction between these two medications, but these two doctors don't talk.
Mm.
Without the oversight, there's entire organizations that have developed just to advocate for these populations, which shows you that there's a great need for justice within those contexts. And so it's important for us to have eyes on the care of our elderly family members. And it's important for us to know what strings are attached when we place them in those communities. What choice do they retain? What choices are taken away from them as a by proxy of becoming a part of those communities, which is one of a huge civil rights infringement that we're looking at right now too, like you said, with the welfare programs, is what are you giving up by accepting the help?
Mm-hmm.
And when there are strings attached to the help that we receive, then we have to be careful about stepping forward, because there could be other prime values. And when it's attached to people's basic needs, that's predatory action. So it's, I think one of the biggest issues in 2021 will be setting the standard that how we take care of our bodies is a part of our civil rights, that we have to be protected in terms of vaccination status. Can't be a question that's asked by our employers or by establishments that we frequent, or are, by hotels, that these things will remain private. Right of access to our private information. And right now we're so willingly giving up so much private information. And what people don't realize is that we won't be able to take that back. Like once it's out there, you can't retract it. And once we give up these rights, it's really hard to reel them back in. We saw the degradation of our rights start after our last huge national emergency with 9/11 here in the US. And so it's being aware that your rights do matter, and that in times of emergency, they matter even more.
Mm. And I wonder if we could finish off with just to give us an idea, expand on that a little bit more of, what is it that we are sacrificing when we give up our health freedom? And for me, I would think of, first maybe define like what is health, and what's entailed in health. As I think of bodily autonomy and psychological autonomy together. But you give up your health freedom, what does that mean for all of us in the future?
The real cost comes down to our future generations and giving up the ability to say how we care for ourselves. Where does that put our future generations in terms of being used by a for-profit industry? And we giving up our voice to determine what is or is not best for an individual completely degrades the sanctity of life. So when these laws or lack of protections for civil rights come into play, it's what's on the line is the, it's my body, my choice. We've heard it for a while now, and it's been well accepted that our bodies are ours and they cannot be violated. That when you're forced to do something to your body, that it's a violation of your person. And so to give that up is huge, especially when, like we reviewed, you can't trust the CDC outcomes and you just can't wholesale trust your existence to other people. People who have chronic illness, they would tell you that it is devastating to have a chronic illness and to have to suffer with that through life. Now imagine these chronic illnesses and the rate of this illness in our pediatric populations. They're not diagnosed at age 40 and 50 and have to suffer with this as an adult and try to function. No, this is their existence for life. They're diagnosed at age 6, 7, and 8 and suffering daily through their primary education. And that's what's at risk, is that the chronic suffering that's become normal will be population wide, and our only focus in society will be taking care of each other. There won't be forward progress when we have all lost our health. And that's what's at stake, is losing our right to health and freedom and joy in life. And our kids deserve better. Our future generations, your kids, your grandkids, you deserve better, so it's worth standing up for, just to preserve the peace of mind that no one else, the government, the industry, does not have the right to violate my body.
And one of the things people come up with is, well, your rights end where where mine begin, kind of, and they're trying to use the harm principle, right? But what's interesting about this is I think there's a lack of proof to demonstrate, like you were saying with your unvaccinated biological children, there's a lack of proof to demonstrate that me as an individual am going to, just because I'm not complying, am going to make you sick. I wonder if before we end, if you could talk about that. And I just want to give, before you start, there's this quote, a Buddhist quote from an author who wrote a book called The Bodhisattva Way of Life. And he talks about how it kind of addresses people's attempts to control everything around them to make the world better. And he says, where is there enough leather that I could cover the whole world so that I could walk without hurting my feet on stones? And then he says, well, why don't I just wear a shoe?
Right.
I wonder.
It's that health being a personal responsibility. No one can do it for you. You can't do it for anyone else. And saying that, if your vaccines truly work, if your health measures work, then why am I a threat to you? And there isn't enough evidence to show that those who are complying are no longer a threat. So can you show me that the solution you're presenting is sure shot, is going to cover the population? And the science isn't there to do that. And one of the most traumatic things that we've undergone over the last year is the perception that healthy people are a danger. That healthy people are threatening the existence of their grandparents, are threatening the existence of the vulnerable in the community. And it's a form of torture to force people to believe that they are sick when they are well. And someone's not transmitting if they are not sick. You're not transmitting a virus. And as people try to digest and chew on these things, if they come up for enough air to see through the fear, then they start to think logically. that, oh, I am okay. Like there's been flus and coughs and colds and viruses going around for my entire life. And we know how to use common sense and we know how to stay home when we are sick. And we can reject the perception that healthy people are a danger to their community.
Mhm.
And that you start asking moms. I had a mom tell me one time, she's like, aren't you glad that all of your son's classmates are vaccinated so that he can be safe? And I asked her, I said, like, for example, which vaccine? And she said, well, hepatitis B. And I said, oh, well, to my knowledge, there's no sexual interactions or needles being shared in the classroom setting. So this is not something that my son is threatening your child with. So it's just the logic being used of really diving into what are we protecting against and who is at risk and who poses a risk, and looking at it that way instead of saying, oh, well, all vaccines are equal and the effect of all vaccines are equal and everyone who gets a vaccine has an equal effect. It doesn't hold water. The more questions you ask, the more that the logic falls to the floor, and that notion that healthy people are a threat to others.
Mhm. Yeah. And I think maybe that's where it should start and end, is really that we ourselves have to ask. We have to keep asking, and that is what's going to give us informed consent, because we can't really take it for granted that somebody is going to tell us the whole story, or that they know the whole story. Is there are a lot of well-intentioned people, but nobody knows the whole picture. So Leah Wilson, I want to thank you so much for joining us today and telling us about Stand for Health Freedom. I'm going to put a link in the description for everybody to check out the website and to subscribe. So here in Canada, you can find out about their Canadian campaign. And some of the other things we mentioned, like AHRP, I'll put down there as well. So thank you very much, Leah.
Absolutely. Thank you, Amy.